The term pedophilia denotes a sexual preference for a body image of prepubescent children, so children who have not yet reached puberty. We diagnose a pedophile sexual preference if these sexual interests in the children come along with sexual fantasies, urges, or behaviors towards these children, and the person feels distressed by them. The term hebephilia denotes a sexual preference for pubescent children, so children who have reached first stages of pubertal development, and if these sexual interests come along with sexual fantasies, urges, or behaviors towards children, and the person feels distressed by these.
The diagnosis of pedophilia and hebephilia is based on an extended clinical interview. In this interview, we ask about sexual fantasies, ideas, and behavior of the person. The most important criterion is the sexual responsiveness towards prepubescent or pubescent minors.
Pedophilia and hebephilia can only be diagnosed by a medical doctor or a psychologist. Within the prevention network Dunkelfeld, an additional training in sexual medicine or sex therapy is required.
The development of pedophilia or hebephilia is determined by psychological, social, and biological factors. By now, it is not clear for research how these factors have to interact for the development of such a sexual preference.
Until now, there is not much data on the exact numbers of pedophilia or hebephilia in the general population. First studies showed that approximately 3 to 6% of participants felt sexually attracted towards children, although these numbers cannot be generalized to the population, to the overall population. Most of the participants or most of the persons feeling sexually attracted to children are men, so women who actually feel sexually attracted to children only account for a very small percentage.
Not all cases of child sexual abuse are being committed by pedophilic or hebephilic men. From research in convicted child sexual abusers, we know that only in 40 to 60% of the cases such paraphilia can be diagnosed.
Not all pedophilic or hebephilic persons commit child sexual abuse offenses. According to our clinical experience, many of them are able to control their real sexual behavior.
From a scientific point of view, we do not know if the consumption of sexual abusive images trigger sexual offending. However, the consumption of sexual abusive images is a criminal offense, and therefore we try to find solutions during therapy with our clients so that they can stop their problematic behavior.
The German term Hellfeld denominates cases that are officially reported by the legal authorities. In child sexual abuse, however, the majority of cases are never being reported and thus show in no criminal statistics. In German, these cases are denominated the Dunkelfeld.
The therapy offered to help-seeking persons aims at preventing child sexual abuse or the use of child abusive images in the internet. Thereby, the project directly supports child protection by working on the topic before abuse happens.
Therapy includes aspects of sexual medicine, cognitive behavioral and medical treatments. It's focused on individual needs concerning problematic sexual behavior.
For a successful therapy, it is important that the patient and the therapist work together. The patient needs to take an active part in the group and to attend regularly. And the therapists, we need to develop our skills and in order to get better.
Therapy extends over a time period of 1 to 2 years, whereas the time period can be handled flexible and with weekly sessions, both for group setting and for the individual setting.
The main goal of therapy is behavior control. The medical treatment can reduce the sexual drive, and some of our participants use this option to support the process.
Child abusive images are often used by our clients to satisfy their sexual needs without doing a sexual offense. Most of our clients do not have an understanding that we have a sexual abuse behind those images. However, our clients suffer from using them, so we target the behavior during therapy.
Although all of the outpatient clinics within the prevention network are funded by governmental institutions, they work independently of these institutions. So no personal data are conveyed to third parties.
Therapists working in the project are obliged to maintain confidentiality concerning every information they might get referring to child sexual abuse or abusive behavior that happened in the past. In fact, breaking a breach of confidentiality or secrecy is considered to be a criminal offense in German legislation. The legal situation in Germany is one of the basic issues in order to establish a prevention network as we have it here, as otherwise we would not be able to reach the people and to offer them help and therapy. In case of possible actual risk situations concerning child sexual abusive behavior, there is a plan in the network which we work on together with the clients and do it on a transparent way with the highest priority, of course, to avoid child sexual abuse.
Aim of our therapy is to prevent child sexual abuse. Our experiences in the therapy groups show that this is possible by reducing the risk factors and by enhancing the behavioral control. It also helps the patient to accept his preference and to integrate his sexual preference into his self-concept.